In this facility, we have got 341 male inmates and 23 female inmates. It is a challenge for us in the fight against the violence, and without your support, we might be defeated. But your support will enable us to fight against the violence. So we appreciate so much for the effort you have done, and also the effort of everybody, even the staff here, to maintain the cleanliness and the measures which has been gazetted in the fight against the conflict violence. And so today, the Deputy Governor and the CS and the Kenya Progressive Nurse Association, we really appreciate what you have brought for us, and I promise you that all those things you have brought, they are going to be used for their purpose and for fight against the prison within the prison area. We ask you to be still partnering with us in any help we need, especially on medical officers and any other medical equipment we require in day-to-day fight against the COVID-19 viruses. Therefore, I welcome you again and again in these institutions. You can be coming and see what we are doing, and also to give us more advice on how to go about it. Because if it is like here, it will be a disastrous, and we hope God will not allow it.
Surveillance is very good. We thank the members of the community, because what we are sensing currently is that the members of the community do really understand the threat of this disease and the role that they are supposed to play. Because on average, we receive more than 20 calls in a day from the members of the public calling us to cases that they suspect could be people who are having showing the signs and the symptoms of corona, or people who have a travel history. And even late night they are calling, and I thank the health workers who have been responding 24/7 to these cases. There is no case that we are taking lightly. We don't just receive the calls and we respond to all the cases, and we responded to so many cases so far. But I call again to the members of the community. If you suspect anyone, yes, you've called us, but please wait from us, because there is some protocol to be followed. There is what is called the case definition. The health workers will look at the person reported, the suspected person reported, whether that person is actually meeting the case definition for the person to be quarantined and subjected to the tests and the specimen to be taken. But then the biggest challenge that now we are facing here is rumors and a lot of propaganda, and that is instilling a lot of fear in the people. For instance, someone will report some patient or some suspected patient somewhere, and then all of a sudden we are on social media and talking about, oh, a case has already been confirmed there. So I really don't know how people do diagnose people through the phones or the social media and all that before they have even seen, because this is something that takes a very intricate procedure that actually has a national attention and is actually done in Nairobi. And when a case is confirmed to be positive, we know where the communication comes from. It comes from Nairobi, from the health ministry, either by the cabinet secretary or the CS, or even sometimes the president, who communicate to us the number of cases that have been confirmed to be positive on that day in the previous 24 hours. It shows the seriousness of this issue. So we should not take lightly something that is so serious, and we have to be very much also be aware to the fact that whatever we are doing could be a crime, because they are instilling a lot of fear and spreading rumors and all that, and also risking the lives of people. Because when you go out and communicate and even put the names of the people who you suspect, who have not even to be having confirmed, even if they are confirmed, their names are supposed to be as private as possible. But even when they are suspected, you put their names, the social media and all that, and those people are stigmatized. We even know of people who are threatened when their phone numbers were published, and told that so and so phone number, so that and that, is corona positive, and the person, people pick the number from the social media, and the person anaambia wewe ndio unatuletea corona, utakuja put our lives at risk. We are already in a war. This is a very big war. So that's one big appeal that we are making to the people of Garissa. This is the time to stand together. This is the time to show big heart. Everything small that we can afford will go a long way in arresting this situation and in winning this war. The health workers understand the seriousness of this disease and how big this war is, and that is why they are helping us at the hospital in the front line, and out there they also want us to help us in preventing against this disease, and they have shown a very big heart to come up with this very big initiative. As a county, we are coming with all measures possible to ensure that, one, we are very much prevented, but even in case we have positive cases, so we are very much ready to manage professionally, isolate, and manage patients as per the protocol that is required. I confirm to you that there is no confirmed case in Garissa so far. Other than the rumors that people have been relying on or thinking 1 or 2 specimens have been sent, we have sent so many specimens to Nairobi. We have sent not less than 4 so far, and all of them turned to be negative.
We understand the risk involved in, faced by our correctional facilities. If this disease, that is the coronavirus, goes into our correctional facilities, then it will be disastrous. It will be very dangerous, owing to how our facilities are. I'm sure with the kind of briefing we got, there's so much preparation that has been put into place in our facilities. We are happy so far that even sometimes even they restrict movements of even staffs that stay outside the prison facility. So mine is to urge the team here, headed by the regional coordinator and the guys in charge of this facility, that they should not take anything, or they should not leave anything to chance. Don't leave anything to chance, please, because this is one area that if it gets this coronavirus, it will be a pandemic and disastrous. And you can imagine someone who was just going out there to get their daily bread has been asked to stay in the house. So please, this is the time to give out. Let's give out. I urge actually the residents of Garissa County and even beyond, people in the diaspora, others outside the borders of Garissa County, family members in Nairobi, other parts of this nation, to please assist their brothers and sisters in Garissa. To actually sensitize the locals on the need to actually invest in the preventive modalities in how to prevent this coronavirus disease. To date, we don't know any cure for this disease, but what we are told is that we prevent from it getting to us. So the advice given to us in terms of by health authorities and those authorities at national level, that issues like social distancing, sanitizing, washing hands, hygiene are actually issues that will prevent us from getting this disease. So I urge the residents of this town and within the county that they should heed the advices given to us by those authorities. We will continue as a county, to sensitize and actually call for help from any body and authority and association within and outside Garissa County.